The headline medical stories that affect you and your family. This is What's Happening in Health.
Morning, everybody. Welcome to What's Happening in Health. So grateful you are joining us here on your Sunday morning. Got a great show for you this half hour, beginning with what could be a breakthrough in clinical trial enrollment. A local healthcare provider is simplifying this process, and he's actually here with us today in studio. His name is Dr. Dylan Steen, and we are so excited to share how you could help thousands get into life-saving studies. And it's a crib changing the lives of those who have babies who are born addicted. We share just how it's giving a helping hand in the neonatal intensive care unit and beyond. But first today, our top story is on pets and your health. We love pets here. New research shows having a dog or a cat in your life can boost your well-being as much as having a spouse, according to the journal Social Indicators Research. Pet lovers such as Chris Seelbach say it's not hard to see how scientists came to this conclusion.
I think the study kind of tells us what we already know, which is that the things that make us most happy in our life are sometimes our pets.
Chris has several cats of his own and recently joined the team here at this Ohio SPCA.
Whoever you are, most people love animals.
The shelter here, full up. So if you need a reason to adopt one of these adorable pets, here's a few facts. After analyzing 2,500 households, researchers found that pet happiness is on par with human happiness. Deanna Rowe, a health coach with Ohio's Christ Hospital Aim for Wellbeing, told me part of the reason for this, not only do pets keep you active,
they can also give us a very deep sense of purpose. You know, our pets need us, and so when we feel needed, that can give us a lot of sense of purpose too, which is really important for our well-being as well.
Measured another way, this study found the joys of owning a pet made people as happy as receiving an extra $90,000 a year. It's a whole lot of money. If you're interested in adopting a pet from the SPCA, they would love to have you reach out to them. You can find a link inside the digital version of this story at what'shappeninginhealth.com. On now to our donor of the week, a local man proving that even in retirement, there's still plenty of ways to give back. This is Bruce Emerson. He says he's found a new way to spend his free time, and that's rolling up his sleeve to help save lives. He's now on his third donation, where he says his donations are making a real impact.
It's something that I can do, takes very little time. It's relaxing, actually, and you get little benefits.
Yeah, if you are interested in donating blood or platelets, you saw that yellow bag there. Those are actually platelets, and they really need those right now. As a thank you this month, you'll receive this limited time Cincinnati Reds hat. To schedule an appointment, you can call 513-451-0910. And the blood that you donate does stay in our area, and it is promised to area hospitals based on these appointments. All right, just ahead, new numbers on autism. We share what providers say we should know about them in healthy conditions, and a program to streamline getting patients registered for clinical trials. Dr. Dylan Steen joining us from the 1819 Innovation Hub at the University of Cincinnati. It's next on What's Happening in Health.
This portion of What's Happening in Health is sponsored by Metro and Gastro Health.
Hello, everybody, and welcome back. In Healthy Conditions today, a recent report on autism from the CDC shows the rates of autism are increasing in the U.S. According to the Centers for Disease Control and Prevention, in 2022, an estimated 1 in 31 children diagnosed with autism spectrum disorder by the age of 8. Now, that's an increase from 2020 when it was 1 in 36. But public health providers say our heightened awareness of this disorder has led to changes that have likely also bumped up these numbers.
In 2013, what many know as the diagnosis of Asperger's was rolled in by the DSM-5 criteria into this autism spectrum disorders. And over the years, we have kind of increased the types of issues with social and neurodevelopment to expand the sort of diagnostic criteria. And that's why you see more people who are given the diagnosis of an autism spectrum disorder.
Now, while no one cause has been identified, studies in multiple continents have found no link to vaccines leading to a higher autism risk. All right, on now to our wonderful guest in studio. I want to introduce you to Dr. Dylan Steen. Tell us a little bit about who you are and what you do.
So my name is Dylan Steen. Thank you for having me. So I am a clinical trialist. I work at the University of Cincinnati. I direct our cardiovascular clinical trials and population health research program. And I also happen to be an entrepreneur.
You know what? That's why you're here today. So we love this whole idea that you have something called a high enroll program. Let's just talk about what is that? How did you design it? Give me a little background.
Sure. So I've been noodling on how to improve enrollment of participants into research studies for a long time. And so High Enroll is a company that's sort of born out of thinking about that for a long time. So the biggest problem in clinical research or human-related studies is really finding people to participate in the studies, whether they be of diets, exercise programs, drugs, vaccines, surgeries, you name it. We do studies to understand what the benefits are and what the risks are. Finding people to participate has been a really big challenge for decades and decades and decades. If we could resolve it, we could actually do more research and help improve human health. And so High Enroll was our attempt to chip away at that problem and really help research sites like your neighborhood hospital or private practice know what studies are going on, help you as patients know what's going on, help your doctor know what's going on, and improve the problem.
That's no small task. So we have a couple of photos that you sent us, just kind of you promoting this. So you've launched High Enroll. By definition, what is it and what does it do?
So it's a software platform. The general concept is to bring awareness of what research studies are ongoing in your community to you, the healthcare provider, and to you, the patient. And so if you know what's going on and you can make engagement easier, we think that you'll be interested in participating. And just to show you a quick example of how it works.
Okay.
I'm a pretty busy doctor. I have a pretty busy day. I have all my studies one touch away here on my phone. There it is. There's the High Enroll icon. I can go right in there. I can jump to University of Cincinnati, and I can see every single study now ongoing at the University of Cincinnati.
Okay,
Isn't that great?
I mean, an app that tells you every trial I want to know in my community is essentially what we're looking at. And then you have what on this? You have a website that also has the same information? Murphy's Law of Media. It'll kick you out right when you're like, hey, it's all ready to go. I know that the trials are changing kind of all the time, so having something that you can upload and change and make continually available will make a difference. Okay, so what are we looking at here?
So here is the High Enroll website. If anyone wants to learn a little bit more, you can scroll through and you can see we have all kinds of information about the platform, all kinds of information for research sites, those places that actually enroll the participants, like a community hospital or like an academic hospital or private practice, but also for sponsors, companies or even the NIH that fund these studies and actually are charged with actually executing across the country or across the world.
Okay, so the app is sort of what you designed to help me already grab this information right at my fingertips. And
Correct.
I can download that by just going to Google Play?
Right from the App Store.
Okay.
Right? So if you're a clinician, if you take care of patients, you can download it and see what's available. If you're a patient, you can go to actually something called Patient Enroll and see what's available.
Okay, so then once you see that, what do I do with that information?
Yeah. So as a doctor, what's really critical is I know exactly what's going on and I have all the information here to understand whether the patient in front of me is eligible for a study. That's really, really important, right? Because I'm not going to talk to a patient about a study unless I really know that he or she is eligible, but also that I think it's the right thing to do. Then directly out of the system, I can contact the research team member that works in my hospital, or maybe even at another hospital if I'm looking at a study that's participating at a local outside hospital. And then I can sort of give them all the information to the patient at the end of the visit so that they can read about it themselves, they can take it home, they can share it with their loved ones, and they can think about whether they want to participate.
So is the app designed solely for healthcare providers, or can a patient use it and also kind of do their own digging?
Both.
Okay.
So we try to provide the entire ecosystem for providing awareness and engagement for the two key stakeholders: the healthcare providers that are charged with taking care of the patients, and also the patients themselves and their families.
So that's brilliant. And I think the whole thing this does is what we all are kind of put on this earth to do, which is would give you a chance to get cutting edge research, maybe save your own life if you needed to. And more importantly, this is how we fuel the next steps in medicine. So we're going to have you stand by.
Yeah.
And we're going to continue that conversation, because I think that's the part that has held us back in clinical trials. We don't understand the value of what they do to change lives. So you're amazing. We're going to come right back with Dr. Steen. So glad to have you in-house today.
Thank you very much.
Yeah,
I
thanks for
appreciate
being here. All right, just ahead, a weight loss drug showing long-term promise. We're going to explain how in Gut Instinct. And a college professor sharing his experience for a better cause. We'll tell you more about it in High Tech Health here on What's Happening in Health.
This portion of What's Happening in Health is sponsored by Northern Kentucky Area Development District.
In Gut Instinct today, some encouraging news about the effectiveness of a popular weight loss medication. The European Association for the Study of Obesity found the drug tirzepatide, which is marketed as Zepbound or Mounjaro, can help people lose weight for up to 3 years. Doctors say some patients lost 10% of their body weight, others as much as 30%. In High Tech Health today, a college professor with cancer using his experience to educate others. He's teaching a class on dying from lung cancer as he confronts his own diagnosis of this disease. Dr. Bryant Lin is a physician and professor at Stanford University. In 2024, after dealing with a bad cough for months, a CT scan revealed what many refer to as never smoker lung cancer, stage 4. The news was a dose of cruel irony, he said. Dr. Lin co-founded the Center for Asian Health Research and Education.
The areas is lung cancer in people who have never smoked, because it disproportionately affects Asians, and particularly Asian women.
Now, while receiving chemotherapy treatment, Dr. Lin saw an opportunity to talk to his own class. His class is called From Diagnosis to Dialogue, a doctor's real-time battle with cancer, and it covers the entire spectrum of this disease as seen through the eyes of someone living with it. Dr. Lin says he plans to teach his class for as long as he can. And now to some other health concerns. A woman's health concern we know is PCOS, or polycystic ovary syndrome. It is caused by a hormone or hormones that are out of balance in the body. But as one mom found out, diet can make a difference. She started with subtle changes, more fresh foods, more plant-based meals.
I did want to see exactly, what kind of things I could do to best improve my health overall.
And then Hida Weber reached out to Jamie Sanzier here at Ohio's Christ Hospital Aim for Wellbeing. Her main goal?
I also wanted to start a family and start trying to get pregnant.
Jamie is a functional medicine dietitian who specializes in PCOS.
And I worked with her a lot on food relationships.
For Hida, that meant fewer processed foods and more whole foods overall.
She found ways to make small changes and incorporate them into like a regular diet.
Hida added more lean proteins.
Protein is really important for helping stabilize blood sugar.
More plant foods, which included beans, nuts, and seeds loaded with fiber.
Fiber is also something that really goes overlooked.
She also got more good fats, whole grains, plenty of leafy greens, and fresh fruits. This not only got Hida feeling better, but remember her ultimate goal?
That did happen, and now I have a beautiful baby girl.
Little Ella, now 9 months old. Both mom and baby are healthy and doing well. Mom says she's pretty much incorporated many of these diet changes for life. If you'd like more information on maybe Jamie's program or Aim for Wellbeing, 513-791-5521. And we also have a link inside the digital version of the story if you'd like more information or like to make an appointment at what'shappeninginhealth.com. All right, we want to join Dr. Dylan Steen once again. You are from something called the Venture Lab 1819. Tell me about that.
So at UC, innovation is a priority. And the Venture Lab is what I would say is a collection of resources as well as experts to help take ideas into products or programs that actually live in the world and benefit humans in some way. So I'm a physician, clinical trialist. My two co-founders were also physicians and clinical trialists. And we didn't know about starting a company. So where do you start? Well, the Innovation Lab is a great place to go to basically sort of learn about how do you think about starting a business, what are the first steps you take, and then to actually sort of potentially get involved in either finding some funding for it or to do some prototype testing, that kind of thing, to really help get people off the ground.
So you then took high enroll, and were you able to prototype test and show that enrollment went up in clinical trials when people started using it?
Yeah, so high enroll was sort of formed right outside of the university, but we did do the prototype testing and so forth while I was in the university. And yeah, our data look really, really great. So the way to think about us a little bit is as sort of like a marketing platform, right? So if, let's say you had a car dealership, or let's say you had a new restaurant, what would you need to do? You would need to basically let people know what you offer, right? What's new, why should they care about it, what the features are, where to go, what it costs, where you're located, the whole thing. That's what we do. So we have shown like outstanding increases in the amount of clinicians, doctors, nurses, so forth, that know about research studies, where previously they didn't, and patients that know about research studies, the engaging with those. And we don't actually sort of track enrollments per se, because we have an open access platform. But we know that our sites that we support are enrolling much better because of us.
Interesting. So we have a little video of research, some of your team, and I think part of the barrier to clinical trials has been, I don't want to be a guinea pig. And so every time I can, I try and address, you're not.
Sure, sure.
Talk to me about how this is really the future of medicine.
Yeah, so clinical research studies are important for a whole variety of different reasons, basically to understand how anything works, what the benefits and what the risks are. Clinical research enrollment has been the biggest challenge and actually the most expensive problem for doing clinical research studies. So we are there to sort of lower that barrier, make it cheaper, and also make it more broad and accessible. We want people of all types, young, old, whatever race, ethnicity you are, whatever type of community you live in, wherever you live, to basically have the opportunity to participate in clinical research. Clinical research from a patient perspective is an amazing opportunity. Here's what we know. In many cases, the best therapy out there may only be offered through a clinical research study. We use the term trial for that. Also, just by participating in a clinical research study, we know on average patients do better. I'll say that again. Just by participating, even if you don't get the special diet or the special drug or the special intervention, you will on average do better. And why is that? Because you have a dedicated team looking at you, making sure you're getting the best possible care, doing extra testing, doing a whole variety of support things to make sure that your health is good. So for a long time, we've really recommended clinical research participation just for those sort of benefits. And again, participation in almost any study will have benefit for the patient.
Yeah, it's so interesting. All right, so we can find your program by looking for the app.
Yep.
We can tell our doctors about it, that kind of thing.
Yeah.
And you have these now at pretty much sites across the country listed once we go there?
Yeah, so we talked a little bit about the Venture Lab. So we got started there. We've been in the marketplace now for a few years. So we have institutions from Harvard to the Mayo Clinic down to small independent practices. We're located all throughout the United States. And the research site we support can be little research sites in a shopping center up to very, very big academic hospitals in all areas of research, from dermatology to cancer to surgery to cardiology, you name it. So we're growing quickly. We're really, really excited about that. And we've even started partnering with the pharmaceutical industry and the National Institutes for Health. These are sort of the big what we call sponsors or the big funders of research out there. So
and if you don't get people, you don't get funding, and we don't continue to fuel success.
It's been a really fast journey. We're learning all the time, and beyond the app, we've also been updating healthcare systems websites. We offer a whole suite of tools that go well beyond this, again, with the overall goal that we can bring awareness and engagement to research at the local level, which is where healthcare and research really happens, to everyone that's involved, from your doctor to your family.
Well, coordinating that is no small task. We look forward to following up with you as the program grows. It's really impressive. I appreciate your passion.
Thank you. I appreciate it.
Yeah, good to have you. All right, just ahead, new concerns about what's leading to higher pregnancy death risks. We'll share that in Legal Medicine. Stay with us. In legal medicine today, pregnancy-related deaths are rising in the U.S. A study published in JAMA shows a 27% increase in deaths from 2018 to 2022. The biggest cause of pregnancy-related deaths is cardiovascular disease. It's followed by cancer, mental and behavioral health disorders, and drug and alcohol abuse. And on that note, we want to leave you this half hour with so many children now born with problems from their moms who use opioids. The medical community is embracing some newer technology. Jessica Vintoner's foster son struggled to sleep through the night. He suffered from neonatal abstinence syndrome, drug exposure in the womb that causes infant irritability, excessive crying, seizures, and a host of sleep issues. Then Vintoner discovered smart bassinets.
When he would cry or cry out in an uncomfortable way, the bassinet would start to move back and forth gently to kind of soothe him and provide a little bit of comfort.
New smart sleepers created by the company Happiest Baby use sensors to detect discomfort, prevent rollover, and soothe with rocking and sound. Caretakers digitally control settings and track the baby's sleep. Eager to spread the word, Vintoner told her foster son's NICU nurse about the technology.
And I started doing some digging.
Her hospital in Vermont got its first SNU bassinet in 2020. Now they're up to 5. They say the bassinets shorten NICU stays and improve sleep scores. Plus, nurses report saving up to 2 hours per shift they would otherwise spend soothing babies.
The first thing that we do now is get the bed and get all the pieces needed to make it operate. It's changed our practice.
As the opioid epidemic rages on, this nurse believes the technology is critical.
I don't expect, unfortunately, that there will be less incidents of exposures to substances, which is sad. And, but all we can do is sort of support these families and support these babies as best as we can.
Vintoner says her baby is safe and thriving, in no small part thanks to his smart bassinet.
This is incredible that it's come full circle like this. I can't wait to tell him about, everything.
It's a sweet mom. And Healthy on the Go is coming up on our What's Happening in Health. We believe transportation here is really important in good health, so we're going to tell you how to get around this summer without having to pay for parking. Stay with us.
The headline medical stories that affect you and your family. This is What's Happening in Health, sponsored by Mayfield Braden Spine.
Morning, everybody, and welcome to our second half hour here on What's Happening in Health. So grateful you're joining us here this Sunday morning. Got a great show continuing for you today, including information on this new device, recently approved by the FDA to reduce ringing in your ears. Joining us in studio to tell us how it works, we want to welcome Dr. Emily McMahon, and her mom, who goes by Beth, came in today. So glad to have you here. Nothing like a mom to help you demonstrate. We love moms here. And by the way, happy birthday, Mom. And it is the summer season of fun. And since transportation is an important part of good health, we have some great ideas to help you get around. Brad Mason, the Director of Communications for Metro, joining us. So glad to have you here. We're going to let you know what you need to know to enjoy the ride. But first, our top story this half hour as we continue to mourn the loss of Pope Francis from a stroke. It's important to remember our own potential risks. Strokes come from a bleeding in a blood vessel on the brain called a hemorrhagic stroke or a blockage called an ischemic stroke. Well, nobody is quite sure which kind led to the Pope's death. I sat down today with stroke specialist Dr. Andy Ringer of Ohio's Mayfield Brain and Spine. Due to the suddenness,
in all likelihood, again, it's most likely that the Pope suffered an ischemic stroke.
Quite often, previous conditions such as heart problems, high blood pressure, and uncontrolled diabetes raise the risk for this kind of stroke. But Pope Francis also had a recent bout of pneumonia, which could have contributed to this complication.
When you have a flu or some other inflammatory condition, then that can change the way your blood clots and can increase the risk of stroke or a heart attack.
Dr. Ringer says it is unusual for this kind of brain injury to lead to sudden death.
But there are certain parts of the brain that are really critical towards basic wakefulness, and if a stroke happens in that area, it can suddenly cause a coma and result in lots of other changes.
In the midst of our sadness, however, we are reminded of this.
The Pope's passing can serve again as a service to the rest of us to be aware of those health conditions so that we can try to treat them in advance.
Dr. Andy Ringer from Mayfield Brain and Spine, we appreciate that advice, and he reminds us to use the BFAST acronym, which stands for balance, eyes, face, arms, and speech. If you notice changes in any of those, it is time to call 911. All right, in healthy caregiving today, new global study finds middle-aged Americans show some of the highest levels of loneliness. Led by Emory University, a researcher there, the study finds loneliness generally increases with age. But the U.S. and the Netherlands were the only countries studied where middle-aged people feel more lonely than older generations. Being unmarried, not working, having depression and poor health, all among the major reasons cited for loneliness. All right, just ahead, new research on Alzheimer's disease, some remarkable brain findings to tell you about, and ringing in the ears, new therapy that Dr. Emily and Beth are going to tell us about. Stay with us on What's Happening in Health.
This portion of What's Happening in Health is sponsored by Life Enriching Communities, NKADD, Huxworth, and Aptiva Health.
In your healthy future today, scientists at Columbia University are finding new signs that risk factors and biomarkers related to Alzheimer's are associated with cognition much earlier in life than we previously understood. The study highlights risk factors that can be seen as young as age 24 to about age 44. Researchers say the findings reinforce the importance of early prevention. In Healthy Diversity today, the Center for Closing the Health Gap invites you to learn more about your own health, a little differently than in previous years. Instead of one expo in Washington Park, they are switching to a series of smaller programs to help with your own health needs. President and CEO Renee Mahaffey-Harris joined us on last week's What's Happening in Health show to tell us a little bit more about the health of our community and how to improve it.
So we're moving in a new direction because of our mission. We are here to close the health gap. And while the expo has been a wonderful environment to bring us all together, we couldn't follow people because we weren't registering people. And so being able to do things in a smaller setting so that we can actually register people, that we can bring in the right expertise, and that we could build a conversation that enables people to get the resources and thought processes to really begin to activate their own agency and advocacy in their health.
If you'd like to learn more about some of those smaller sessions from the Center for Closing the Health Gap, you can click inside the digital version of this story at what'shappeninginhealth.com. All right, on now to our wonderful audiologist here, and she has a great solution if you've had ringing in your ears. Tell us who you are and what you do.
Hi, I'm Dr. Emily McMahon, and I am an audiologist.
All right, and you brought friends.
I did. This is my mom. This is Beth McMahon, who is both my mom but also a patient of mine that I've been seeing for her tinnitus for the last couple of years.
Okay, so let's get first, what is the definition of tinnitus?
So most commonly people describe it as ringing in the ears, but it is a benign body sensation that people experience. Most of us will have experienced it and are not bothered by it. For about 20% of the US population, they are bothered by it, and then about 10% are quite disabled by their experience of it.
So can I ask what you were hearing?
So what I hear is a very high-pitched ring constantly. So,
and was there a trigger, or did that just start overnight? Or
I have had tinnitus problems most of my adult life. So in the early stages of this, when Dr. Emily, who is my daughter, I wore hearing aids that helped with it to a certain extent. But as it went on and I got older, the tinnitus just kept becoming more prevalent in my ears. And it can be very disheartening, probably is the best way I can say it.
It interferes with so much, doesn't it?
It does, especially sleep.
Yeah, that's the number one complaint that I've heard from people. So you have a solution a lot of us are not familiar with. It is not necessarily a hearing aid.
Yeah.
What is it?
So this is what's called the linear tinnitus device. It's a bimodal neuromodulation tool. So fancy for two pieces. So piece one is using these headphones. So this is the ear stimulation. And the second point of stimulation is using this tongue tip stimulator. So we're delivering positive both sounds and stimulation to the brain and helping the brain learn a new response system. So rather than just responding to the tinnitus like she has been or like others are on their own, they often just get stuck in a loop where they try not to focus on it and it just isn't very nice to them. This is helping their brain learn that redirection or that new pathway so that they don't have to be burdened or stopped by getting caught in that tinnitus cycle. They use this at home, which is nice. They don't have to be in an office. It's non-invasive. And we often start with a period of 12 weeks, 2 30-minute listening sessions per day. And then I'll let her explain a little bit on kind of her experience with using it, but this is her device.
Okay, so you can put it on yourself. Can you show us a little bit about that? So you put on the headphones. And it comes with the set, correct?
Mm-hmm.
And then this is what you called again?
The tongue tip stimulator.
Okay.
So it's a series of electrodes that sit on the tip of your tongue. And then it delivers low-level electrical impulses while hearing sounds. So the sound and the tongue stimulation are in sync. So more sound, more stimulation, less sound, less stimulation.
So you're adjusting, I know she can't speak, but she's adjusting to meet her own needs?
So it is programmed for the person. So an audiologist will program it based on your hearing needs. So we use your audiogram or your hearing evaluation to program the levels of sound that we do. And then we calibrate it to the individual's tongue sensitivity. And then those two measurements are in sync. So each person has their own individual prescriptive profile of what they listen and feel.
So how did this come about? What was behind the idea that the tongue and the ears would kind of all work together?
Sure, so it's an Irish company called Neuromod, and it was a long time project over the years and looking at providing multiple levels of stimulation to the brain to help give the brain the ability to more easily habituate and more easily make adaptations. And so the tongue is the second piece. We've always known the ears and sound and tinnitus are a positive factor, but this is the first device that's been able to go from experimental category into non-experimental. As a provider, it's been just really rewarding to talk to people that we have proven reliability and data, which is lovely because most everything else in tinnitus is considered experimental. So it's pretty cool that they figured out tongue plus ears and how the sound works has been providing significant relief to patients all across the country.
It is very interesting. Can she hear me at all? I don't know. Okay. So does it hurt? Just give me a yes or no. It doesn't make you feel like all jarry or anything like that?
So I like to describe this as like a really carbonated drink. It's like super fizzy soda pop is what it feels like on your tongue. It's not sharp, it's not painful. There are loud, medium, and soft sounds, but none of them should be loud or uncomfortable. In fact, it's designed to allow your brain to just kind of sit back and relax and just get comfortable, something that most people burdened by their tinnitus would say is an almost impossible task for them. So it's a very calming, soothing, both sound and the physical stimulation.
Okay, so we have an animation that you sent us from the company. Is the idea behind this that it fixes it, or you just do it till it's toned down, or how does this work? So this is kind of showing us how it works in the brain.
Yeah, and so we know that having tinnitus is kind of part of that individual's lifestyle, so to say. But what we want to do is take it from bothersome into non-bothersome status. What I mean by that is you and I both have a blazer on today. We both can recognize that it's on and we are not bothered by it. We aren't aware of it. We both have our mics plugged into it, but other than that, we haven't thought about it. Our brain knows that this is not important and we don't need to give it any emphasis. And so what this device is doing is helping teach the brain to de-emphasize that response that it's been providing the tinnitus for all of those years. And so often, and I'll let my mom speak to that, but often what patients will say is, if I were to ask them, do you hear your tinnitus? They can say, well, it's there, I'm aware of it, but it's no longer here. It's not in the front. It's not part of every activity that they do. And so getting into that non-bothersome status is fantastic. So it doesn't matter that it's still present, because the brain is no longer giving it that negative emphasis and just being emboldened by it.
So how long did you use it before you noticed a difference?
Within a week.
Really? So that's a couple sessions?
Yeah, so it'd been about 14 sessions because it's 2 sessions per day.
Per day, okay. Yeah.
Yep. And
so you would just sit down for a few minutes and use it, and then what did you notice?
I think the best way you described it is it's there, but it's no longer there. It's no longer in the forefront. It just kind of gradually just, kept getting to the back of my brain, so to speak. So it was huge.
And so is the idea you keep it forever and just as it flares up?
Yes, I kind of call it maintenance mode. Think of it like we maintain outside routines, food routines, sleep routines. And so we recommend an initial 12 weeks. Sometimes that initial time frame might expand a little bit depending on individual. But like in my mom's example, it'll be 2 years in August since she was originally fit with it. And when was the last time you had reached for it?
Oh, months,
Really?
maybe even almost a year.
Wow, that's amazing.
Yeah, it can just be really just freeing for that person not to feel something that encompassed almost every activity that they were doing, and she hasn't had to actively do anything to maintain it now in potentially over a year plus.
So we want to make sure we put up where people can find you. You have a practice at Flex Audiology, and then are they following this long-term for research to see?
Yes, so there is some longer-term research out of Ireland, which is where it's initially, and then there is some research that's coming here, US-based, any day now. But yeah, so my practice is Alaska Hearing and Tinnitus Center, and then Flex Audiology is a local practice that has welcomed me into their clinic, and I see local Cincinnatians in the Flex Audiology office.
And you said there's a cost barrier, so people just kind of use a payment plan, or what do you do? It's about $4,000 or so.
Yeah, so we do offer payment plans. It is FDA approved, but they did not approve it with a CPT code, which is those medical codes for all thing insurance, and so it is a out-of-pocket expense. Some patients have been successful in seeking reimbursement, but it is a private pay expense at this time.
Well, it is really good to know it's even out there. We're going to continue to put the word out, and we'll put a link to your practice at what'shappeninginhealth.com. We are so grateful that you just came in and explained this, because half of it is finding a solution, is it not?
Yes.
And I'm so glad you're feeling better and sleeping well.
Yes.
And she even came in to join us on her birthday. So happy birthday!
Well, thank you for having us.
We're really grateful to have you here. We'll continue to follow your work. Look forward
Thank you
to
so
it.
much.
Yeah,
Thank
thanks
you.
for being here today. All right, just ahead. Pace yourself when it comes to eating. It could really change your weight and your life. We'll tell you about a new study. And healthy on the go, we want to welcome Brad back. He's going to tell us how to get around this summer season without the parking fees and so much more. Stay with us on What's Happening in Health.
This portion of What's Happening in Health is sponsored by Miami University, the Vein Center of Cincinnati, and Lindner Center of Hope.
In Wait No More today, we hear all the time about what to eat and how it impacts your health, but how fast you eat it could make a difference as well. Doctors at the Cleveland Clinic say people who eat a meal in 20 minutes or less may be eating too quickly. And that's because it takes that long for your stomach to communicate to the brain through hormones that you're full. As a result, fast eaters tend to overeat, and they're also likely to swallow air. That can lead to bloating and indigestion. Some ideas for slowing down: put the fork down between bites, turn off the TV, but not us, and put down the phone while you're having a meal. You also can start counting how many times you chew a bite to try to chew a little longer. In your Healthy Rights today, more patients are becoming comfortable with AI being part of medical care. A study by the Radiological Society of North America found 71% of patients were okay with an AI interpreting their mammogram along with a human radiologist. However, less than 5% of people said they were comfortable with an AI doing that alone. All right, on now to our wonderful team from Healthy on the Go. It is summertime, and if you've been downtown, you know, it can get very congested for sporting events and festivals and, you know, all the taste and things coming up. So we know who to reach out to for Healthy on the Go. Hello, remind us who you are and what you do.
Thanks for having me. I'm Brad Mason, Director of Communications with Metro.
So this is sort of your passion. Summer's great, but you guys have really looked at our city and said, how can we help sort of accommodate everything from no parking fees to getting you place to place? Tell me about that.
Yeah, absolutely. So this all began with the passage of Issue 7 in 2020, which launched our Reinventing Metro plan, which really has revolutionized our system. So you think about it, we've added in more frequency. We've added 24-hour service. We've added in crosstown routes that really help connect people wherever they need to go throughout the region. We have the capability of, it's more than just getting to work. Metro is your way to go. It can connect you, as you mentioned, to festivals, to Reds games, FC Cincinnati games. And like I said, with those 24-hour routes and the improved frequency and service, it really gives more access to be able to attend those and leave the car at home.
Okay, so let's start with just kind of your general summer stuff. We have a little video. You're downtown, and are they frequent enough that I won't have to wait at the bus stop? I'll be safe, that kind of thing?
Yeah, our improved frequency is great. They come every 15, 20, 30 minutes. So you're not going to be worried about, oh my gosh, I missed the bus. It's not going to be here for another hour or two. With that improved frequency, it allows that flexibility to maybe stay there a little bit longer, or you know that you can get to that bus stop and your bus is going to be there very soon.
Okay, so some of that was sort of by design, so I can take the bus part way, walk part way. Tell me a little bit about the planning and whatnot that goes into that.
Yeah, our planners are constantly evaluating our system. They do it every single day to try to serve our residents the best they can. And so we think through, okay, this route would drop somebody off here. Is this a convenient spot for them to be? And how far of a walk is it to get to key destinations in our region? And so we're always thinking about connections. That's what we do here. We connect people to opportunities. We connect people to healthcare. We connect people to entertainment. And so that all goes into our planning system.
Yeah, it's amazing now if you go downtown and when they can jack up the prices for parking, it can be $35 or $40, and Metro has a fare of what?
$2.
$2. Hard to beat that. Yeah.
Right, yeah.
So you mentioned, the doctor's appointments, things like that. One of the reasons that we do a Healthy on the Go segment here is we are very passionate about the fact that it doesn't help you to have great places to go and great medical providers if you can't get there safely and promptly. So you also recently launched something newer called Metro Now. How is that going?
It's going amazing. So what we see from that and what we hear from people is we want more of it. So 2 years ago, we launched it into 2 pilot zones, Springdale, Sharonville, and then in Mount Healthy and Northgate area. And we look at the ridership data on that, and it continues to go up, up, up. And the coolest thing about it is that from that data, we're seeing that people are connecting to grocery stores. They're taking advantage of it to go and get healthy food options, and that Kroger's is the #1 option for people to take Metro Now to. So we're very happy and pleased with that. And so if you're not familiar with it, it's an on-demand service. It is something like Uber or Lyft, where you use the app or you can call in and say, I need a ride within one of those zones, and we'll come pick you up. We'll take you where you need to go for $2.
That's remarkable when you think about that, getting to the grocery store, getting to a doctor's appointment, and you have plans for expansion.
Yes, in early June, we are going to expand into the Forest Park area. So all across that northern area where there's larger populations that maybe our current service isn't serving quite as well, we are able to utilize Metro Now for that.
That's really good to hear, because it's just going to be life-changing for you if you live in that area. And so is the best way, you have a couple apps, is that the best way for me to schedule these, or how does it work?
Yeah, so you can call in for a Metro Now ride, but through the Metro Now app, I think is the most convenient way of doing it. And now we also have our transit app as well too, which helps you schedule and plan your rides and pay for rides on usual Metro fixed route service. And one thing that we launched last week that we're really, really excited about is our Rider Rewards program, which is within that transit app. And you think about programs at different restaurants or retailers where you buy something, you earn points. Why not earn points for riding the bus? And so that's the concept behind it. You earn points 3 times a week. You scan your pass, it gives you points, and then you can redeem those points for free bus passes. We're also proud to partner with places like Kroger, CVS, and Walgreens. Red Bike is in there too. And then also the Queen City card is an option. So there's hundreds of retailers downtown that serves. And we're also looking to expand that and open up to more local partners too.
That is really interesting. I'll be curious to see how that goes, but as we get the word out, I would definitely do that. I love the rewards thing.
Yeah,
that's a
absolutely.
great idea.
Yeah, it's gone well so far, and we've heard from our partner on that it's been the best performing in the city so far. And of course, he may say that to all his clients, but we'll take it here.
No, I would believe it because it's easy to accumulate quickly. Yeah. Well, we thank you for that. It's been fascinating to watch your growth and see how you serve our community. We look forward to having you back as these do continue to grow, and maybe we can take a ride out in one of those Metro Now places.
Absolutely. Let's do it.
Yeah, how it goes. Thanks, Brad. Appreciate you. All right, just ahead, new study on the best diet for your vascular health and your bones. We'll share it in what's on the menu. And our team from the National Kidney Foundation, so glad to have you in house today. In our next half hour, we're going to meet Jamie Brown and Sierra. They are here to talk to us about living kidney donation.
This portion of What's Happening in Health is sponsored by Network for Hope, William E. Hesh Law, and Serene Sweets.
In You're So Vain today, the Mediterranean diet we know is very good for our vascular health. Now a new study shows it's also good for your bones. A study in JAMA Network Open found that a reduced calorie Mediterranean diet combined with physical activity could help reduce bone mineral density decline and support weight loss in older women with metabolic syndrome who are overweight or have obesity. The study involved 924 participants. It highlighted the diet's benefits for bone health, particularly in the spine. In Hope You Know today, new survey is raising alarm bells at work. It's about addiction at the office. Researchers surveyed 1,000 workers across several industries and say job stress, workplace pressure, and financial strain, just a few of the things now contributing to more people using drugs or alcohol or other substances and addictions at work. Now, it's not just the usual addictions that help us cope at the office, such as drugs and alcohol, where you might notice even maybe you smell alcohol on someone. According to behavioral health and addiction specialist Dr. Chris Toole of Ohio's Linder Center of Hope, he says now that pornography, gambling, those things are available online, and these too may be some of what provides a coping mechanism in a stressed out day.
Maybe I'm going to my phone and placing bets at work, same kind of thing. The brain really doesn't care what it is. And there's no way to smell a bad hand when somebody's gambling, right? So those issues can be just as problematic as well.
The survey found 7 in 10 of those who are Gen Z, about 69%, and of millennials also use a substance on a weekly or daily basis to cope with stress at work. 1 in 3 millennials, 1 in 4 Gen Zers reported increased substance use because of fear of layoffs and the use of AI in the workplace as well. And we remind you the Linder Center of Hope will help you with addiction or any substance use problem 24/7. You can call 513-536-4673. All right, just ahead, the benefits of outdoor time we explain in Ask a Nurse. Stay with us in our next half hour on What's Happening in Health.
The headline medical stories that affect you and your family. This is What's Happening in Health, sponsored by TriHealth.
Morning, everybody. Thanks for sticking around for our third half hour here on What's Happening in Health. Got a great rest of the show for you today. We are starting with the annual Cincinnati Kidney Walk with the National Kidney Foundation. We have an inspiring story to tell you about and a little bit more about how you can support this great team. So glad to have them here in-house. With us today, Jamie Brown, the Kidney Foundation's program manager, and she's here with Sierra Rankin. She's a living donor. Can't wait to have your stories told and learn how we can support you both. And why getting outside could be the perfect prescription for good health. We're going to tell you about that in Ask a Nurse. But first, quick headline for you today. If you've been struggling with some common women's health concerns, local providers are encouraging you to reach out and find the right person for your specific health needs. The team at TriHealth recently added nearly 24 women's health providers to their practice from the Seven Hills team. This is all in hopes of improving access to quality care. And they recently joined us for a women's health special on menopause and much more.
everybody responds to that life cycle differently. And symptoms can be addressed in a number of ways, including hormone replacement therapy, lifestyle change, and through education, things can be as wonderful and as positive in our later years as it is in our younger years.
Well said, my friend. If you'd like to know more about this women's health through the life cycle, our program is now online. It is called Changing the Conversation, and you can find it at what'shappeninginhealth.com. All right, our top story this half hour is an Ask a Nurse, and we're asking what simple steps can we all take to improve our mental health? New study used several what they called test and learn green social prescribing sites to find out just how being outside can lift your spirits. Each site linked people with nature-based activities in their own community, either instead of or in addition to traditional treatment for conditions such as depression and anxiety. Out of the 220 participants ages 18 to 85, many reported being in the outdoors made them feel the way Scott says he feels.
It's just soul healing. Like the last couple of days with it being so nice and sunny outside, it's just like a complete pivot in my mental health. It's just like an instant snap to feeling good changes the whole day.
When mental health was measured using a standard depression and anxiety scoring scale, both men and women showed consistent improvement. The kind Leslie Taylor says she notices outside.
I think just walking, clearing your head, taking a little time to yourself throughout your week is always a great idea. I should do it more often.
Those who spent the most time outdoors showed the greatest improvement in as little as 12 weeks. The best benefit overall appeared to come from interaction with others during that time outside, as Kathleen and Lee Dwyer already know.
We like to take the opportunity to be outside whenever we can. I like the wide open spaces. We go camping a lot. We went camping on our honeymoon, and that was 52 years ago, and we're still camping today. And I just love nature. We love gardening.
And especially the springtime, you know, with all the flowers and the trees budding and everything all nice and new. And it's not terribly hot.
Beautiful there, isn't it? If you can't spend this much time outside, they did maybe 60 to 90 minutes, just 20 minutes a day, kind of like taking a nature chill pill. All right, and listen to this today. As we just talked about, people affected by tinnitus perceive sounds such as buzzing and ringing in your ears, even if there's no corresponding external sound. In new guidelines, the U.S. Veterans Affairs and Defense Departments are recommending using therapeutic sounds, cognitive behavioral therapy, and hearing aids or implants, sometimes which are covered as part of your VA coverage, as needed for this condition. We also have information on the device that we shared with you in our first half hour if you'd like to find out more at what'shappeninginhealth.com. All right, up next is your diet, the secret to eternal youth. We'll tell you more in Aging Gracefully. And Jamie and Sierra are here. They're going to talk to us about the National Kidney Foundation and how we can all make a difference. Stay with us on What's Happening in Health.
This portion is sponsored by Good Samaritan College of Nursing and Health Science and the Mental Health Recovery Board of Warren and Clinton Counties.
In Aging Gracefully today, the secret to eternal youth might be in what's on the menu, according to new research on nutrition and healthy aging.
To split it down the middle and also flip it, do the same on the other side.
You see, Ruben Molina knows it's hard to make a meal pleasing to everyone's taste. He's the director of dining here at Ohio's Life Enriching Communities.
Today we're going to be making a pan-seared salmon with a Mediterranean couscous salad.
That means Ruben is responsible for feeding as many as 1,500 people at this independent and assisted living facility. A few of the people who live here joined us for this healthy cooking demonstration, even though Sue Deerenforth admits
my favorite food groups are grease and salt.
In this demo, Ruben is focused on the top 5 nutrients nutrition researchers say we all need to age gracefully. They include potassium, calcium, vitamin D, dietary fiber, and vitamin B12. This meal,
we have some couscous that we'll go ahead and add in there.
The perfect pairing put together. Plus, it's pretty.
a good, well-appearing meal, it's more likely for them to eat and enjoy.
The salmon is a favorite here, Ruben says. After lightly seasoning and cooking it, he puts together the perfect plate. Hummus, couscous, salmon, seasonings, and as for those eating it.
And I don't usually like salmon, and this is wonderful.
Ever had salmon for breakfast before?
Only as lox, and this is very good, and it's maybe we'll start having it for breakfast.
So I've learned a new taste with the hummus.
It's all good, and it's well balanced, and it's really good food.
Look at that. What a pretty plate, huh? If you're interested in finding out more about Life Enriching Communities, here's the number, 877-532-1899. The Aging and Nutrition team there says the earlier you start eating these nutrients, the more they nourish you for life. All right, on now to a wonderful segment here. We call it Waiting for Life. And we have our friends from the National Kidney Foundation here. Tell us who you are and what you do.
Hi, I'm Jamie Brown. I'm the program manager for the National Kidney Foundation serving Cincinnati. So I host educational programs for healthcare professionals, patients, and the general public because, you know, you can stop and slow kidney disease progression. You just have to have the resources and education to do so.
I love that you say that because I recall that you are a lupus survivor, correct?
Yes. I'm a lupus nephritis patient. I've been in remission for 2 years, which means my kidney labs have been stable. I have 74% of functioning, which is really exciting. Lots of diet and exercise, which has been covered in all of these segments, but it is very important.
It makes a difference.
It really does.
Sure. Yeah, and you brought friends. Yes. Hi there, who are you?
I'm Sierra Rankin. I'm a live kidney donor, and I'm also on the Kidney Walk Committee.
All right, well, we have you here because we want to talk about the walk and invite people to come, but I have to explore this donor thing. You got to love on somebody to do that. How long ago did you donate?
It'll be 4 years in December.
And how was that experience?
Fast.
Went fast, went quickly.
Yeah, once you learn that you're a donor and you say yes, they start the process right away.
Well, our wonderful health photojournalist Ryan put a picture of you with your friend that you donated to. Tell me a little bit about that experience. Who was it? How did you sort of meet up with that person, or how did you know them?
So we've known each other our whole lives. She's one of my best friends, but she's more like family. So we've grown up together, shared and loved on the same grandmother and everything like that. She needed a donor, and she was asking all friends and family to donate, and I kind of procrastinated for a while, and then once I found out, they said I was an exact match. Like, there was no better match than a sibling.
So how did you feel when you heard that?
Shocked. Because, I mean, like, you go through the process, but you don't really think that you may be the match. And so when I found out, I was like, okay, and they don't tell the recipient, because you always have that option if you do want to donate or not. And I was like, oh, I have to call her immediately and tell her, because we're doing this. And so when I told my dad and she told her mom, it was just like, when's the surgery? There was no like, are you going to do it or anything? It was, what's the next steps?
What a wonderful friend you are. I mean, just to think that. And I know you have a walk coming up full of people like that willing to donate, or people that need kidney donation. It's a huge need. There's 100,000 people on the waiting list, they say. Yeah. Most of them are waiting for kidneys. So let's show a few pictures and tell us a little bit about the walk and what it's about and that kind of thing.
Yeah, so it's our annual kidney walk. It'll be on May 18th at Fountain Square, downtown Cincinnati. Check-in is at 8 a.m. and the walk will start officially at 9 a.m. It's just a really great way to bring the kidney community together, because, you know, having a chronic illness can be isolating and waiting for that kidney for so long. And so it's nice to get everyone together and celebrate and raise awareness and education and just have, again, a community.
When you are there and you see this sort of sea of people who know, you know, about your friend and what you've been able to do, is it just uplifting and rewarding?
Yeah, I actually volunteered last year at the walk, and that's how I got connected with the foundation. And seeing so many people there and having the shirts and encouraging, and they have like QR codes if you need a donor and stuff, it was really inspiring. So I was like, I have to be a part of this.
And remind me, how is your friend now?
She's doing wonderful. Actually, she's a nurse.
Oh, that's wonderful to
Yeah.
hear. Yeah. And one quick note that someone told me the other day is that you also have priority should something happen to your other kidney.
Yeah.
You know, they will put you up on the list as a person who's donated before. So they're looking out for you for life, because people often say to me, what if I need it? Yeah. And that's an important thing to note. Well, we are going to put a link to the walk. If you can join a team, we purposely try to stay ahead, give you a little time to plan that day, get part of a team, donate if you can, and that will be at what'shappeninginhealth.com. And then along the journey, even prior to this walk, you have regular sort of educational sessions, support programs. So we're going to have you stick around and talk to us a little bit about that, okay? We'll be back with you guys in just a moment here. And coming up, we also want to tell you about how college dining is changing. It's taken a real positive turn. This is Miami University. Some good eating going on. Coming up next, and what's happening in health.
This portion of What's Happening in Health is sponsored by Northern Kentucky Audiology, the Center for Closing the Health Gap, and Journey Light.
In Healthy Innovations today, campus dining getting a whole lot better, according to a recent survey of 93,000 students. At many universities, including those in our area, balanced nutrition is now a top priority. You're looking at Miami University here. They are now making meals that help with sports and athletic performance, and plant-based meals are also high on the list for college dining. Quite a change from the soda pop, pizza, and wings that we used to get on college campuses only years ago. All right, we want to continue our discussion with our National Kidney Foundation friends. One of the things that you try to do is support people along the way. So you, as program director, do what?
Yeah, so I host educational events for patients and the general community to spread awareness and prevention for chronic kidney disease. And we're actually starting a new program during the warm season. So we have a support group here in Cincinnati, and we were like, how fun would it be if we got out and did a little walking group, but then also had a portion of this support program have an educational component to it as well. So we're going to be working with local nephrologists and healthcare professionals, and have a topic at the beginning of this program for about the first 15-20 minutes, and then we're going to go on a little walk around Eden Park, and then that portion will be where we talk about all of our experiences and kind of have that support component.
You know, that is so important. We have a graphic that talks about, you're calling this program
Strides for Kidney Health.
Strides for Kidney Health. So anyone can come, and you know that your friend went through a number of things in the years leading up to this where you really need that support, do you not?
Yes, it's extremely important.
So when she said, hey, it's time for my donation, you've been through several steps now, and so was it helpful to you to sort of learn about it and know what to expect and that kind of thing, and then how it would help her?
Yeah, it was extremely helpful, and the staff and her doctors and everyone gave us a lot of education, and then I also did my own research on it just to make sure, and then with her wanting to be a nurse, we kind of like tag teamed it together to make sure that we was like as healthy as possible and that we could sustain after the surgery.
So your programs are geared to keep the person who needs the donation healthy so they can even receive a transplant should it be needed, correct?
Yes, yes.
So what kind of things do you focus on to do that?
So our first topic, which is going to be April 26th, unfortunately before this segment, is going to be on diet and wellness. We're still coming up with a topic for our June meeting, which will be June 28th at 11:30 in the morning. But it'll be just anything that's kind of hot in kidney care right now. So diet and wellness, CKD and diabetes and hypertension with chronic kidney disease, because those are the two leading causes. So a lot of people will have both of those and how to manage both of it at once, or also how to manage all of the medications that you might be on, or talking about home dialysis. So there's going to be lots of different opportunities for robust information and education out to these patients who come monthly, and then also the general public as well.
So what's really interesting, and your friend probably knows this now as a nurse, is that there are now ways to slow down kidney loss progression. We never had those before. Is she sort of an advocate now for telling people how important your kidneys are?
She is.
Yeah.
Like, she's always telling people about it. She's always trying to educate, and that's why she became a nurse, because she wanted to make sure that she was able to help people like the nurses that were able to help her.
And how was it to be a donor, like in your healing and recovery? Because people always go, is it hard, or did you have struggles along the way, or what was it like?
It was, so for me, when you're a donor, you're tired afterwards. For the recipient, they have an immediate boost of energy. So she was like calling me like, I'm so hungry and I'm doing this. And I was like, I'm not. So, but afterwards, it's perfectly fine. Like I was able to have my second son afterwards and everything with no issues or complications.
Oh, so you had a baby since then?
Yes.
Oh, how fun. How old is your son now?
2.
I bet he's a bundle of energy.
Yes.
So do you share now that this is part of like your legacy and what a difference you can make for someone else?
Yes, so I'm always asking her like, how's my kidney? And so I'm like always checking her diet and everything like that. So it's definitely a journey that we're sharing together, and we've known each other our whole life, so now we're just connected forever.
Yeah, you know what, and your support programs and things, and even the education, are about bringing people together who, you know, it's scary if you need a kidney and you don't know if you're going to find a match. So do they find that it makes a difference to be with other people who sort of understand that?
Yeah, absolutely. And, you know, because it's also not a one-size-fits-all journey. And so being around people who are going through the same thing as you, who have the same fears or anxieties or challenges, is very empowering for them. And it also gives them hope. And hearing living donor stories, because we have people who come who have had a kidney transplant before and are still doing great, but they still want to be there to support the people who are on dialysis or seeking a transplant still, and give them that hope. And that's very important too as well.
It is important because you've been given this gift of life, and to be able to pay it forward and support others, and that nobody knows it like the people who've gone through it, huh?
Yeah.
Yeah. So a couple things, we want to put that graphic up one more time. We can come to those programs at no charge, correct?
No charge. Yep.
And I know you do that because you continue to raise money through the walk and things like that. So a reminder that that walk is coming up on the 18th. This one, you have a program starting this week, but then you'll also have one in June that people can sign up for. And then do you let them sort of contribute to the topics and what they want to know until you learn a little bit more about sort of the needs of the group?
Yeah, so we have surveys after each program that we have that asks people, like, what are you looking for specifically? Are there any challenges that you're having that you would like us to address or bring to the table for these programs? And we definitely try to take those to heart as best as we can. But then we also have to work with like our volunteer pool and what they're passionate about too. So we try our best to bring everything to the table.
Yeah, no, that's, I mean, nowhere else you're going to find that.
Yeah.
All right, I want to give you the final word. What is the thing that you learned about kidney donation, this process, that you find is really important to share with others?
I think that people have this misconception that being a live donor is going to be hard or you're going to have struggles afterwards, and that's not the case. And there's nothing more rewarding than giving someone a second chance at life.
Well said, my friend. Thank you guys. Thanks for hanging with us. What you do in our community saves lives, and we're grateful. And it is so fun to talk to a donor. You go, girl. Can't wait to meet that little one. All right, just ahead, a few tips on keeping your skin healthy as the season changes. So we'll tell you about it as we wrap up here on What's Happening in Health.
This portion of What's Happening in Health is sponsored by Mount St. Joseph University, Elder Law Lawyers, and Advanced Cosmetic Surgery and Laser Center.
I want to leave you with look good, feel better today, and a few nutrients can help boost your skin health. Researchers say fresh fruits and vegetables always lead the list when it comes to top nutrients to fight inflammation or help your skin recover from sun damage and even slow the signs of aging. But there are a few specific nutrients that make a difference in your skin. Here's the list. In those fruits and vegetables, you get vitamin C, which can make a big difference in protecting your skin from those rays from the sun. They actually do studies to give you like a natural layer of sunscreen from foods with vitamin C. Meat and fish, that has vitamin D, and that strengthens the skin's barriers. It can also help you maintain healthy hair growth. Nuts, plant-based oils, whole grains, they are high in vitamin E. That's a moisturizer. You know what that feels like? You can get it in those nuts and seeds, and it helps reduce inflammation. We are so glad you're hanging out with us this week here on What's Happening in Health. We will be back same time next week. Hope that you will be too. Until then, everybody stay well and stay tuned.